coordinator of the Serious Illness Program at Center for Solace, formerly Brattleboro Area Hospice. I think I know most of you. Is everyone okay that we're videotaping this for BCTV? Good, we're good? Okay. So, part of the Serious Illness Program is about trying to find community in illness so that illness does not need to be an isolating experience. So we have volunteers, we have support groups, we have different activities. And so this is a program that Andy and I picked up. And I'm going to let Andy introduce herself, and we'll get on with the program. So thank you for coming.
Thanks. So welcome. My name's Andy Weissman, and I've worked for a bunch of years, actually with Dina as well, in Greenfield for an area agency on aging. And our mission was to help empower, do self-confidence workshops for folks with chronic conditions. And there's a lot of skills that we teach, because it's really challenging to live with chronic conditions. I'm only laughing because it's sort of like, duh. So not only are there medical issues to deal with, which we're going to talk about tonight, from understanding what a diagnosis means, from gathering a medical team that we can trust, but there's finances, there's family issues, there's work, there's figuring out how to find joy and delight, as I quote my friend Dina. So there's a lot to contend with when somebody lives with a serious illness or one that's chronic forever. So we're going to focus tonight on the medical side of that and what it means to be a self-advocate in a medical context, and the goal. I've been leading online a lot, so I feel a little embarrassed about my old school easel and newsprint. It's been a while, but there's the goal. Build our skills and confidence to advocate for ourselves in healthcare when living with serious or chronic illness. So that's what we're doing here. And I'll just say this, and then I'll tell you a little bit about the format. So again, Dina and I worked together in that job, and sadly our program just ended. And Dina wrote this in the as one of the memorials, I'm not sure that's the right word, to the program. And I just wanted to throw that out at this as sort of a vision of medical self-advocacy. I'm not sure I told you I was going to use your quote, but it's a good one. It's a good one. Just the other day, sitting in the car before a visit with a medical specialist I'd never met before, I got myself centered and reached into my toolbox. I made friends with my difficult emotions, reviewed my goals for the visit, and fine-tuned my communication skills before going into the office. I know from conversations with other healthy living leaders that we all find ourselves needing and using the same skills that we teach, which is, we sometimes refer to it as a toolbox. So we're going to be teaching those skills, but that's kind of where we're headed, is be able to use those skills so that we can be more confident and agile, peaceful, successful in the medical interactions that we have. So I'm going to do this little bit of intro, and we're going to talk just a bit about medical advocacy. Does everybody have a handout? Because I'm going to read from one of these in a sec. And then we have a panel, which I'm excited. So this is Dina Standard, this is Donna Macumber, this is Colleen Savage. They're brave and vulnerable and generous to come share their stories about medical advocacy, and I'm really excited about that. So that's the meat of our program. And then what we're going to do is glean from their stories strategies, tips, things to say, questions to ask. We're going to glean from those stories what we can take away to help empower ourselves. There's a little bit toward the end also from the medical provider perspective. I thought that might be good, like what doctors ask of us, because we have some responsibilities in that relationship as well. So we'll do a little bit of that at the end, and then there's a few takeaways at the very end before you go to say, okay, here's a challenge to leave with. Any comments or questions? We're here for an hour and a half. Everybody know where the bathroom is and stuff like that? Everybody, what are your any needs or announcements before we go further? Okay. So medical advocacy. So I wanted you, if you take your handout, I'm excited about these handouts. I gave you 3 pages. And on the last one, it's the AMA Code of Medical Ethics on patient rights. I just thought that'd be kind of handy to have. And I wondered if somebody would just read the first paragraph. Because that's going to be the vision of what medical advocacy we might aim for. Anybody game to just read it? That'd be great. Thank you.
Patient rights. The health and well-being of patients depends on a collaborative effort between patient and physician in a mutually respectful alliance. Patients contribute to this alliance when they fulfill responsibilities they have to seek care and to be candid with their physicians. Physicians can best contribute to a mutually respectful alliance with patients by serving as their patients' advocates and by respecting patients' rights. And these include the right.
I'm thinking the first four. Do you mind? Are you
No.
having fun still? Just the first four.
A right to courtesy, respect, dignity, and timely, responsive attention to his or her needs, to receive information from their physicians, and to have opportunity to discuss the benefits, risks, and costs of appropriate treatment alternatives, including the risks, benefits, and costs of foregoing treatment. Patients should be able to expect that their physicians will provide guidance about what they consider the optimal course of action for the patient based on the physician's objective, professional judgment. To ask questions about their health status or recommended treatment when they do not fully understand what has been described, and to have their questions answered. And fourth, to make decisions about the care the physician recommends, and to have those decisions respected. A patient who has decision-making capacity may accept or refuse any recommended medical intervention.
Thanks. So just as a focal point, what that means, and I feel free to add, I'm just going to riff a minute on what that means. So that means that we speak up for ourselves, that means we are partners in decision-making, that we ask questions and our questions are heard. There's a lot that all implies, and we're gonna dig into depth about what all that means as we go. So I just thought that would be a nice piece just to have in your packet as well. And just to also say before we begin, is that not only when we are self-advocates do we feel more satisfied, we feel more in control, we make better decisions, and we sometimes are able to counteract inequities. If we can train everyone to be self-advocates, we can kind of begin to tackle inequities in the health system, but it also has better health outcomes. Like they say, people have better outcomes with their conditions when they do that. So, and I don't have the exact stat, but you can find that in research everywhere. Like, it makes a difference, not only in our well-being, but in how our health outcome ends. So, that's my case. Yeah, Laura?
I
Hi.
was wondering if you could say more about what you mean, how does it affect the outcome?
Yeah, I'm not sure I can right now, but, well, so why don't, let me hold on that, because we're gonna hear, I think you can answer, let's see if we can answer that after. That's a great question. I think we can answer that after better. I'm not sure where that stat comes from. I think, here's the one little extra sentence I didn't add. Fewer negative events during treatment and a more positive overall health trajectory. So let's find, we'll hear some more personal examples of outcomes and see, but stats say that it makes a difference. Anybody else have a comment or want to answer that?
I wrote one little snarky comment, which is, or less negative events during treatment, like fewer negative, or like easier to head them off at the pass sometimes if you have better,
So we're going to hear some
We should be
personal
careful what we
examples to answer that too. So we'll have to do more research about what doctors say about it. So what I thought we'd do before the panel goes is to take a moment for you guys to share some of the challenges, what makes it hard. And I had this thought that it might make sense to divide it into 3 parts, but I'm not sure that will be useful, but That's what we'll go with for a minute. So what makes it hard, and I'm gonna give you a minute to think about, you might even jot it down, to do this self-advocacy in the medical context? What are the barriers? What are the challenges we face? I think that'll be helpful for our panelists to bounce off of as well. Where do we get hung up? And the last thing I'll say before I get your comments, the three categories I put is like systemically, so there's all kinds of systemic challenges, there's individual provider challenges, and then there's attitudes, our own attitudes and beliefs that can get in our way for advocating too. Things like the medical system knows everything, or I don't want to cause a fuss, or so that we also have our own personal attitudes and beliefs that sometimes hang us up in our ability to advocate. So I'm just going to open it up and hear from some folks. What gets in our way? We'll spend a few minutes getting this list, and then I'll turn it over to our speakers. Hi. Yes, ma'am.
So, yeah, one thing that's hard for me is that even, I have found that even naturopaths, like, are pushing drugs, you know, and like, they just don't get it when somebody like me says, no, I don't want steroids, no, I don't want this, I don't want that, and they just don't get it.
Thank you. Thank you. They have a certain way they want to do it, and they're not listening to your, it seems stuck, yeah. Great. What gets in your way? What makes it challenging? And this is in our workshops, we ask this too, and this is the moment where people can really unload. So feel free to, as you're warming up, to think about that. Like, this is an opportunity to just get your rage out if you'd like. Yeah.
Feeling like I'm pressured for time because they seem like they're in a rush.
I'm not sure if that's system. I'm going to put that under system, right?
Yeah, I think it is.
Right, because they're pressured for time as well. I think that construct comes from above
Yeah.
the actual provider.
I think time goes in all three categories.
Say more.
It's an issue everywhere. Does the provider have enough time? Does the person taking my medical history, who's not the provider anymore, have enough time? Does the person I'm making appointments with have enough time? Do I have enough time to ask the extra question, right? Time is the magic sauce.
John.
Well, I think of this from a male perspective, and that as a man, you know, part of my training growing up was to diminish health concerns, you know, to like put them on the back burner. They're not a big deal. I can deal with it. It's not about not wanting to bother somebody else as much as it is maybe even admit to myself that there are things going on.
A real man doesn't have those problems.
Thank you, George.
How would you like to,
Oh, it's definitely in that category.
just give me the capsulated phrase.
Wow.
How about
Oh, George, help me out.
I'll do a real man ... Is
Yeah,
that
yeah,
okay?
Yeah.
Great.
Immortality.
Yeah, George.
I'm not sure where it would go up there.
Yeah.
But
I'm
I
not sure
find
this is helpful.
if I'm not prepared for the visit, and for me that means making actual notes that I can take in, I sometimes will come away saying, I forgot to mention X. It's a preparation act, but I don't know where it goes exactly.
Let's do it.
Wherever you like.
Thank you. Leo and then Laura. Thanks, you guys.
It can be difficult to take in the information that a medical provider is giving because the moment can sometimes feel overwhelming. And, you know, so I like to have somebody with me if I'm, you know, because I know that I have trouble taking in what somebody's telling me.
So I want to see, I think that might be in two places, but just to say, taking somebody with you is one of the strategies that we'll definitely like highlight, because that's a biggie. Are you thinking that might be just the moment or the provider overwhelm or your own overwhelm or both?
It's the patient, the individual feeling, there's a lot going on.
Right, and yeah, some people can get really anxious, and especially if I'm scared or have other emotions, or I don't feel good, or, Laura, sorry.
Well, I'm wondering about things that feel sort of cultural, like what Joni was talking about, it's like part of the culture. And if you think of system, meaning the whole system of how everything works, not just the medical system, that could go in that category. But then also the attitudes and beliefs are cultural things, so I wasn't, I
Well,
wanted
say
the
more
word,
about the.
I wanted the word cultural to be, culture to be in one of the categories, but
Can you say a little more about how culture's a barrier to getting
I
what we
think she
need?
means the dominant culture.
Yeah,
You mean
yeah,
like
yeah.
the dominant culture?
And what does
Right.
the dominant, how does the dominant culture influence our ability to
Well,
advocate
it's-
for ourselves?
for one thing, it's sexism is part of that, feeling like as a female, you don't have as much, I don't know, smarts, that, and you'll be sort of showing everybody that you're not smart if you say anything. That's sort of how it seems to me.
Yeah. Anything else you wanna, any other ways the culture, I think, I'm just gonna add racism. Dawn and I have been talking about that some too. We know that people of color as well as women have not only worse outcomes, but they have noted to have less care and less responsiveness, and so I'm gonna add it.
And not everybody's pain, I think,
Ableism?
is seen. You know, there's not an equality in how people's pain is seen or respected, right? So depending
I'm
on.
gonna add that. Not everyone's pain is seen in the same way, is that okay?
Mhm.
And then, Dina, say what you just said about ableism, if you don't mind.
Just that it's similar to not everyone's pain is seen is that it gets in the way. People make assumptions. So as patients, but also as physicians and providers, there's a lot of assumptions.
Yeah, we'll get everybody. Yeah.
Oh, related to that, like people's previous or like childhood experiences with doctors?
Yeah. Whoever
The
just,
woman in the back of the room has been.
Tara, I'm sorry, I missed you.
It's Tara.
Tara, I'm sorry.
One thing, I don't know where it fits in, but I'm thinking information transparency. Like I have a team of doctors, and a lot of the information that they should be knowing about each other is not transparent to each other.
Right.
And so up to date. So I feel I'm educating some of my providers when I go see them because they don't have the same information.
But before we go on, how would you like to encapsulate that in a phrase?
Oh, I don't know, my brain can't.
How about, is it okay, lack of communication between providers?
Yes, that's a good one.
All right, hang on.
Um,
Yeah, go ahead.
And then lack of information of what services I'm entitled to. I only found out about certain services at one of my hospitals when I saw it in a flyer. No one had told me that I was eligible for certain services, extra services, until I saw it. So like that, I think is really important for being a stronger advocate and feeling more confident, like if I know what to choose from.
Is it okay if I say not informed
Not
about,
informed, yeah,
about options?
Yeah,
Is that system? Again, I'm not sure that matters.
I think it belongs in at least a couple.
Yeah, there's a lot of them,
All right, how about
there's a lot of
provider?
interrelationship between the lists.
Right. And again, I'm not sure that it's helpful to have these three lists, but whatever, thanks for your patience. Not informed about options, okay?
Options and services.
Yeah, thank you. Let's
This
hear,
person hasn't spoken yet.
Johnny, will you just call on folks for me? Just, you decide.
I'm Karen.
Hi, Karen.
So to sexism, racism, and ableism, I would add ageism. I think this may be gradually becoming somewhat less true, but there is a fair amount of assumption about what you should expect at a certain age. And if you go in and try to advocate for yourself in regard to pain or disability or whatever, sometimes you get kind of a dismissive, kind of what did you expect, you're old.
Don't you hate that phrase, as we get older?
Yes, yeah, you should be okay with this condition because that's what happens when you get.
The other part of that, and I'm not sure how to say this concisely, but I run into it in several different situations. People who are trained in geriatric medicine sometimes have a hard time understanding that quality and quantity of life are two different things. And maybe very emphatic about what you shouldn't take or what you shouldn't do because you're over a certain age. But not using those medications may make for a very diminished quality of life. And sometimes there's a lot of judgment around that.
Would you mind just summarizing that in a few words so I can put that up there?
I'm pretty
That's-
hoping.
No, that's great.
George is good.
You can just put quality versus quantity.
Yeah,
of
great.
life, because I think that spills over into a lot of situations.
Yeah. Well, and who's doing the measuring?
Yeah.
I'd say about the ageism too, it also goes for people who are younger. They don't believe us, and they don't think that we actually have the thing that we actually have, and we get erased a lot of times.
That's being a woman more than anything else, because it's still happening to me, and my hair is a lot more gray than yours. So,
Try getting a shingles vaccine when you're under 50.
yes, right. No, absolutely.
It took
So-
me 3 months to get a doctor to actually like put it in my arm because
Yes.
I wasn't the right age.
You weren't the right, so but that will not,
Yeah.
it will not dissipate as you age. It will still be like,
But I
are you
wanna-
serious?
But I want to
It's two
honor
different
Colleen's
issues.
point, so ageism can go either way.
Yeah.
So certainly youth keeps us from some resources or people make assumptions about us. I think we're going to get last two and then we're going to turn it over to this panel.
For systemically, confidence in the system is one.
Yeah. Yeah.
And second, I'll make what, for the middle,
For the providers and stuff.
no, our attitudes and beliefs is your ability to articulate what is wrong.
In 15 minutes under a ton of pressure where you don't feel good and you're terrified. Yeah.
Yeah, or you might be so sick that you can't speak.
Right.
And related to that is language in general. That language is a barrier. If your first language is not the language of the medical providers that you're seeing or the system within you're working, there can be a lot lost in between, and do you even have access to healthcare if you can't communicate effectively with your providers?
I'm going to pause this here.
Language and cognitive decline.
Thank you. And Leo, last one?
Well, I would just say, I add socioeconomic status. I work with a lot of homeless people who don't do well when they go to the doctor.
Why is that?
Yeah, what does that mean?
Their conditions aren't taken as seriously. They're blamed for their difficulty in consistently accessing medical care.
They're seen as non-compliant.
Right, their level of pain and disability is frequently discounted.
So what's the ism? I'm trying to think of the
Socioeconomic.
Classism?
Classism.
That's what I'm working
But
on.
although it's an extreme form of classism.
Yeah.
Poverty, hatred, actually.
There we go, thank you for the term.
Okay.
So you guys, I'm going to pause us here. And what we're going to do, we have this amazing opportunity. I feel really grateful and excited to be part of it. And I don't have an order, you guys. I hadn't thought about order, but maybe we just go down the aisle. And they have 10 minutes each to share. The questions they were asked is what were the challenges that you faced? What's your condition? What is the challenges that you faced manipulating, that isn't the word, navigating the medical system.
Sometimes we have to manipulate.
And what were the strategies that were, what were the strategies? And so that's what we're gonna, and so what your job is, and not only what were the strategies that they did, but also we're gonna kind of glean strategies, questions they asked, phrases that were helpful, and your job while we're listening for the next 30 or so minutes, and if you wanna jot it down, is to note the strategies, because when they're done, we're gonna glean that to put it on a piece of paper too. So jot them down. When you hear like, oh, that's a strategy I want to use, or that's a question I need to ask next week at my appointment, or that's a phrase that's a really good way to confront my doctor. So just write down best practices as you hear them, and that's what we'll collect when they're done. Everybody okay? All right, so I'll just be your timer. So I'm thinking 10 minutes with questions, so I'll probably do like 8 minutes,
Yeah.
something like
Okay.
that, and then
An
you
8-minute.
and then a 2-minute questions.
That sounds good. Just-
Thanks, you
I
guys.
need a 30-second wrap up.
Okay.
Hi, I'm Dina, and I have 2 serious conditions, chronic conditions that I'll sort of put on the table for you in my experience. The first is that I am a person with, I'm a person disabled by progressive juvenile onset spine disease. I had my first surgery when I was about 40 and the 5th one in February of 2024. And that has been, it's been a lot. I raised children while figuring out I was disabled, and had to figure out how to parent differently, and had to figure out how to human differently. And my condition is hereditary, so I also had to figure out how to contend with afflicting my children with something that I don't use that word lightly, I experience as an affliction. So there's that whole thing, and that has taught me so much about things that I've had to contend with, like the expectation that my spine disease, I have a spinal cord injury, but you can't tell looking at me. So my disability is mostly invisible until you see me walking, and I use a cane now. So I present as more disabled, but I didn't used to. So the invisibility and contending with people expecting me to be fixed after each surgery, like, aren't you better now? No, I've bought some time on my feet. And what I call bootstrapping, which I've done a lot of as a disabled person, which is pull myself up by the bootstraps every morning and just go, as well as I'm able. And I think that's a true story for a lot of disabled people. That, and all of this has been certainly my reality. The other chronic condition is new. I had a very serious heart attack on Christmas Day, and I'm a woman, so I didn't know I was having a heart attack. I spent half an hour in the shower waiting to feel better, because that's where I go to feel better, and it wasn't happening, and I still didn't dial 911. So it took a long time to get to the right hospital with a cath lab. I live in a rural area. It took 24 minutes for the ambulance to get to my house. Then another 45 minutes to the hospital that was gonna fix it. And I'm really lucky I got there. But I had this moment in the ambulance. And I had this moment in the ambulance. I'm an end-of-life navigator. I work with people with serious illness and people with terminal diagnosis. And there was a part of me that was like, oh, I should watch this very carefully to learn what I can for my clients in case they need to ride in an ambulance, because, that's how you think. And it got very quiet in the ambulance in that moment, and I just felt like, oh, the ambulance is not necessarily the emergency. Like nothing prepares us for these, we don't talk to our other friends who've had dire ambulance rides. Have you ever asked somebody, what was it like what were you thinking while you were in the ambulance? We don't share with each other enough about these circumstances. So like, I didn't have anybody in my head whose hand I was holding, some friend who said, when you're in that situation, remember this. Like, so that my takeaway from the heart attack and the ambulance ride, one takeaway was, we have to talk to each other about this experience. Like, I'm not gonna make this a secret. You know, neither that I had the heart attack or that, that we're not talking about when we're in the middle of an emergency, what are we thinking? And who are we? And what's our identity inside that? Because then you get to the hospital and it's an emergency and they're like doing their thing and they're asking you all these questions about yourself. And I'm trying so hard. I am a disabled lady. I've been hospitalized 5 times for spine surgeries. I've been through it. And I'm just trying so hard. I'm having a heart attack and I'm trying to be personable. I'm trying not to seem non-compliant. I'm working my ass off not to appear non-compliant. It's Christmas Day, but I'm Jewish, which is part of the moment in the hospital for me, because they're like, oh, we're sorry you're missing something. And I'm like, I'm not missing anything. Just take care of me, please. Like, and just all these parts, and you're racing through it so fast, and then you get into a bed, and always, as a person with a serious illness, as a person with a chronic illness, as a person with a terminal illness, when we're in the hospital bed, we are on our own. It doesn't matter who's there to take care of us. We are the only person who has to figure out how to pee, because we have to ask for help to be able to pee. And if we ask for the right help and make ourselves less work for the nurse, it might be, they might like us better and come sooner when we ring the goddamn bell. So all of this in the swirl of how we survive these experiences, I'm watching the clock.
Are you?
Yeah, no, I'm watching the clock. I'm kind of just about done. So, speaking up for ourselves when it's critical, when we're in the doctor's appointment, right, and we're getting new information, and we really need them to tell us about the resources that are smart to ask for. That's hard to do. I don't like to bring people with me to my medical appointments. It's too private. I don't even like to bring my husband with me to my medical appointments, because I can contend with my worry and fear, but not both of our worry and fear. So, you know, there are lots of reasons why we all know it's smarter to bring someone. I lost a friend over bringing someone, and I never knew why. They just stopped sort of talking to me after the medical appointment, like maybe it was too intense. I don't know. But, so they're really good. Like, one of my kids I would bring with me, because she can think and be impartial. Like, she has that skill. But it's tricky. So you know, we're gonna come up with tools and suggestions that sometimes are appropriate for you and sometimes aren't. But having, this is the thing about the toolkit, right? The magic of the toolkit. You don't have to use them all. There may be one you seldom use, but that one moment your mind goes, oh, I could try that here. Yay. So everything you hear about today, take it with you in your pocket, stuff it in there. And then, you know, you're able to unpack it as it's needed. Nice alarm.
Subtle, right? And you have 2 minutes for questions?
Yeah, so anybody?
Have a question?
Just one question, you mentioned you lost a friend. Were you accompanying the friend? Or
No,
the
she was
friend
accompanying
you?
me.
I just, which way?
I've accompanied all sorts of other people to their medical appointments when they pass, but that was like, yeah. Yeah. I didn't think I was going to do that.
Okay.
Any other questions before we roll along? Thanks for listening, everybody.
Thank you
You
for
should
sharing,
be,
Dina.
I guess applause isn't the right.
No, that was
I know
good.
what-
That was,
I know what- maybe
a
we-
breath
I
is
just
really
wanna-
nice. Sometimes when I'm in groups of people, this is, if you're ever at a memorial service and clapping feels really weird, try this.
So any of us who feel like that, just to thank them for speaking, I'll just do that. Nice. Donna.
Thank you. Hi, everybody. My name is Donna Macumber, and I am so grateful. I'm grateful, Andy and Eileen, that you're bringing this conversation to our community. It feels like such an important conversation for us to have, and for us to have not just in pairs, but in rooms like this. I want to own that I come to medical advocacy very organically, in that my mom, when I was 10, was misdiagnosed by a very confident physician. She had a tumor that she was told, this is nothing, she's fine. She let it go for 6 months. She had, cancer and radical mastectomies, and I lost my faith, and I stopped giving my faith over to doctors. So as a very young woman, I interviewed my doctors. I said, I'm looking for a consultant because I don't have a lot of faith. I want somebody to help me navigate the things that I experience in my body, because I know my body very well, but I have never been to medical school. So I think for me, taking that step as a 24-year-old was really powerful. I interviewed 4 doctors. I kept my clothes on. I opened my mouth. I asked my questions, and I got an awesome physician, Tim Schaefer, who's at Grace Cottage. So I have been very healthy most of my life, and I've had 2 significant experiences that really bring medical advocacy into sharp focus for me. One of them was in the summer of 2023. I had COVID, and shortly thereafter, I was walking up a hill with my dear friend Sarah, and it felt like somebody unplugged my energy. I couldn't breathe. I felt like I had no energy whatsoever. Many, many months of tests and diagnoses and exams and questions. There was something going on with my heart that the medical establishment couldn't quite get to the bottom of. And it was a very scary time for me, because I couldn't walk up a flight of stairs without feeling winded, and I'm somebody who has had the privilege of walking 3 or 4 miles a day and trusting my body to do the things that I wanted it to do, and that is a privilege. So it ended up being suggested that I needed a pacemaker, and that was fairly terrifying. I've never had underlying heart disease. So how did I navigate that, and what might be helpful for me to share? I did a lot of research. I asked dear friends about cardiologists in this community. I couldn't get a call back from a cardiologist, and time was ticking on, and I was getting more and more afraid. So I handwrit in my calligraphy handwriting to Dr. Carl Zott in this community. I wrote down my questions. I introduced myself in this letter. I gave my phone number. I said, I'm scared. I don't know what's going on. Please call me back. And Friday night around 5:30, after I hand-delivered my letter, I got a call back from Dr. Zott. And that began some exquisite coordinating between Dr. Zott and Dr. Silverstein, and I eventually had surgery. Now, the week before surgery, I was still feeling very apprehensive. Somebody's gonna cut into my body. What are they gonna find? My grandfather was a physician and died of a major heart attack when he was 51 years old, and I had that sort of history playing through my mind and my heart. So I wrote a letter to the man that was gonna operate on me, Todd Silverstein, who was over in Chester, and a wonderful human being. And I said, I know you're very busy, but you're gonna cut into my body on this date. Thank you so much for being willing to operate on me. Here are 3 pieces of writing that are really important to me as a person, that somebody who's gonna cut into my body should know about me. And I know you're busy, so they're short pieces of writing. The day of my surgery, he came in, he came up to me, he put his warm hands on the soles of my feet, and he said, I read you, I got you, are you ready for this surgery? And that was just a human moment for me, because I really think that humanizing the medical establishment is really important. And part of it is, when we can humanize something, we're more likely to be seen. Now, I'm a white woman, I'm educated, my professional work is advocacy. I work at the Women's Freedom Center and have for 30 years. I know how to advocate for other people. What I am having to learn is how to advocate for myself when I'm, afraid. I'm afraid that I'm gonna die. I'm afraid of, of losing all the things that are precious to me. And I'm afraid of all the uncertainty that I was feeling. So that's one experience. I learn people's names when I'm calling offices. I thank the people that are doing the grunt work. I have been called persistent a few times, and it has not been a compliment. I've had to endure that. When somebody says you're very persistent, I say thank you. Yeah, this is really important to me. The second event is that on April 20th of this year, my partner and I were on our morning walk on South Main Street, and we got hit by a car on the sidewalk. And it was very, very terrifying and sudden. We were hit from behind. We didn't hear the car coming. The driver fell asleep. I broke the windshield with my shoulder. I was thrown up onto Prospect Cemetery. Both of my legs were broken, and my life partner was wedged between his vehicle and the stone wall of the cemetery.
Oh, wow.
So that is a very different situation. I am still mending from that, and it was Easter Sunday, and I am barely Christian. What is it with the holidays? But there weren't many people around. The Christian holidays, a lot of people were taking it off. Anyway, so in that situation, it was very difficult to advocate for myself. I was on oxycodone for 3 days, and I have very low tolerance. I didn't know what was going on. So the difference between being cognizant and aware and scared, but able to navigate and advocate for oneself is very different than being very vulnerable and medicated and hospitalized and having somebody very close to you who's in an extremely compromised situation. At that point, my sister and my dearest friends began the role of medical advocacy for me. They made sure they knew what I was feeling, what I was needing, what I was wanting. They checked in with me. They met my basic needs, like bringing me a toothbrush. Nobody was bringing me a toothbrush for 24 hours. So basic things. People cooked for me and brought food in. So I think the work there was, as soon as I began to land back in my body, I knew, they kept saying they were going to send me home, but I had 2 broken legs. I had had surgery. I had a titanium rod from my kneecap down into my ankle. I couldn't move very well. So I knew that I was going to need, and my partner was going to need, longer term care. And I was on the phone, still on medication, calling Grace Cottage, saying, and my partner and I are both really injured. We want to come do our rehab there. Both of our primary care physicians were there. We called and reached out to them. And then later that day, we were transported in 2 separate ambulances to Grace Cottage, where we got exquisite care. It wasn't just medical. It wasn't just physical. It was spiritual. It was emotionally intelligent. We were able to say what we needed. We were kept in the same room as partners, given a white down comforter, which felt a little bit like our bedroom. When we would wake up sobbing, thinking, what the hell happened to us? There were nurses that had the time to come in and crouch down and hold our hands and spend 10 minutes talking with us about the trauma of having been so hurt, of not being able to help one another. So 2 very, very different experiences of really needing to learn how to go through something that I've never been through before. And I think my biggest takeaways are to humanize. When I am feeling sad and scared, I let myself cry. And when a doctor is rushing me, I'll say, I am gonna ask you to give me a minute, and then I'll thank them for giving me a minute. So being present in this body, I'm much more able to say the things that I'm thinking and feeling, and to navigate with that skill set that is a professional one that I'm learning how to channel into my intimate sphere of this body and this time in my life. So, and I also just need to say, because I'm a passionate anti-racist organizer, that I have worked for 30-something years, and Leo, you talked about people not being heard. I really believe that many people of color in this community are seen as med-seeking. I have strong feelings about the ways in which those of us who are white and educated and able-bodied are heard differently than somebody who is perceived as potentially to blame for the things that are falling apart in their lives. I have a lot of strong feelings beyond my own body, but yeah, I just needed to say that into the room, so thank you for listening. And I'm happy to answer any questions if anybody has a question.
How's the pacemaker?
You know, I don't feel like I use it very much, Leo. At the end of the day, it was determined that it was COVID wreaking havoc with my whole body. And my cardiologist said the one thing the medical industry seems unwilling to invest research dollars in is the relationship between COVID and the incredible uptick in heart issues in this country. So I don't think I needed it in the long run, but I was grateful that people were working to help me figure out how to climb hills and stairs.
I asked the cardiologist the day after my heart attack, how many of the people you're seeing right now with heart disease have had COVID, and the correlation is so strong, and it's not really mentioned. But many younger people, many people who may have had a predisposition for heart disease, but lived in a way that they would never necessarily have had it. There's just, the heart stuff is huge right now.
So I have a question for you. I just wonder, in hindsight, is there anything that you would do differently to make experiences like this go better, easier? You know, I mean, we all have the possibility of anything like that and a million other things happening to us. What would you have liked to have had in place beforehand, or
Do you mean for one or the
whether
other
it's
of those?
relationship, yeah, for either one,
Either
whether
one.
it's about the relationships that you've built with people, medical, or just your community, your network, your heart network, or
Yeah. I mean, I think what's so interesting is these two incidents brought me into a deeper level of vulnerability than I have ever experienced. I think I needed to land with my naked little feet in that plot of vulnerability in order to know what I could do differently. And I think, you know, being seen, being visible, telling the story has been healing in a way. The tidal wave of love that has come from this community has been healing, but I don't think I am clear enough yet to articulate what I wish I would have done or what I would do differently. I think it's still in process. Yeah.
Not a question, but a comment.
Yeah.
And I'm realizing that we made a major omission to things that make it hard to advocate for ourselves under system, and that's just availability of services. I just wanted to comment, Donna, on how fortunate you were when you called Grace Cottage that they had beds available for both of you. I know at least 3 people who I can think of very easily who have had serious injuries, extremely serious injuries, and have languished in the hospital without rehabilitation because there was no bed available, and or ended up so far away from home that it was horrendous for their families to, or impossible for their families to support them. And they were alone a great deal of the time.
Are you writing down best practices? Just a reminder.
I don't think most of them have pens, Andy. So, you know, just so you know.
Feel free to pull up a pen or note it in your mind.
Yeah, some of us have pens and can't write, so.
It's sometimes
I can
hard to
look
write
at it.
when you're so absorbed in
Yeah.
what you're hearing.
Thank you.
I keep thinking I ought to be writing things down.
Colleen, thanks for coming.
Hello, I'm Colleen Savage. I have rheumatoid arthritis, amongst other things. I have undifferentiated connective tissue disorder and severe osteoporosis. I laugh at the question of what challenges have I faced in trying to meet my medical needs, because like, what haven't I been faced with? Like, what haven't all of us been faced with? Like, it's not so much a part-time job as it is a full-time job at certain parts of your life. I found out I had RA 4 years ago on an after-visit care sheet.
Oh, wow.
My summary printout for my doctor's office. I always read over them, but just kind of glanced over it. And when I saw seronegative rheumatoid arthritis listed, and I was like, oh, neat. I have a diagnosis. Not neat. Nobody told me. That's weird, because I'd already started taking medication to help with it, because my blood tests don't come back as having RA. That's the seronegative part of it. So when you test outside of the parameters for certain diseases, that's a really big challenge. I didn't have family history until I was on medication for 3 years, and then my sister said, oh, Grandpa took Humira as well. And I said, that's neat, what did he take it for? And it was for rheumatoid arthritis, and I did not know that, and nobody shared that with me. So yet another challenge. I've had numerous issues with prescriptions, from pre-approvals to doctor's office sending them to the wrong pharmacy. That happened to me, and then I didn't have my medication for 3 weeks, and then when I got it again, it no longer worked. So I got to try a new one, and it takes 8 to 12 weeks for my medications to fully kick in. What else? Certain medications aren't covered by insurance. It's a lack of rheumatologists in our area, but that is not true. There are no rheumatologists in our area. There's a severe lack of them. There's only one in the greater area of Brattleboro in Keene, and I saw one who went there, and then she moved 2 hours away, and I couldn't find anyone else, so I had to go 2 hours away until I found someone else, and that appointment took 6 months to be able to go. So now it's 40 minutes away in Northampton, and that's fun. What else? Finding care and scheduling appointments has been a struggle. I started having symptoms when I had a 6-month-old baby. So, as you said, that whole figuring out how to parent thing is hard enough as it is when you're a new parent, but figuring it out on top of figuring out why do my hands not work, and my hands and my energy are so important. I couldn't vacuum. I lived in Philadelphia in a tiny row house, and I think my husband still thought I was lying when I was like, I can't vacuum the downstairs anymore. It hurts too much. But now he gets it, and I don't vacuum still. Did that. I wasn't able to work. I started working about a month before my son was born, and I did not start until last September. I didn't have the energy, I didn't have the mental capacity. There's a lot of people don't know about rheumatoid arthritis. Let me rewind. Rheumatoid arthritis is a progressive chronic condition. It gets worse as you get older. There is no cure for it. Medication helps and it can get you in remission. It is closer to lupus than it is to osteoarthritis. When people ask what's the matter with me, I generally say I have a rheumatic disease that affects my joints or a systemic disease that affects my joints, because they don't get it. And I'm too young for that, and all sorts of things when I actually use the arthritis word. So I'm on my husband's health insurance. He was laid off twice in the last 12 months. That's terrifying, and what a challenge is that when you're trying to get your medical needs met. Stress is one of the biggest impacts on my condition, and the idea of him not having a job really causes a lot of stress. And the financial burden is real. When he got laid off this past year, I was $1,000 away from meeting our yearly deductible. So, yeah, and that was April. So to tell you how much money I spend on my medical condition, it's insane. How was I able to get my needs met? I think the biggest thing has been the years of experience, and I found a great program online that helped educate me about rheumatic diseases, and it was a support group as well, so getting to know other people who have similar afflictions was a huge help. From one of the people in my group, I learned about a great phone app called Guava that I use for symptom tracking and medication tracking as well. It's really nice because it has everything in one place. So I don't have to go to the BMH portal and the Mass General portal and like all of them to get all of my records and to answer the questions. I can literally just turn on this app and it's right there, and I click buttons to say that I took medication, and I know I took it and I won't forget. These are like a lot of the tools that help me, like they make me feel like I'm more in control when I feel like there's so many things that I'm out of control of. I think my diagnosis has made me realize like how little we really have control over so many things, and yet also to like rely on myself more than anyone else. Like, you know, what we're talking about, like medical advocacy, like you can't rely on your doctor to tell you what's going on exactly, or to do what they say they're gonna do. Which is a terrible statement to make, but in April I found out I had an MRI and I didn't get the results from the MRI. It was on a Saturday. They told me I should have the results by Monday. Nothing was on the portal, no phone call was had. So I waited until Thursday to call, and they said that they sent my results to my PCP. Well, my rheumatologist ordered the MRI. So I was like, well, she needs it, not the person who didn't order it. Long story short is my doctor's office had my results since Monday, and I had a fractured pelvis, and nobody decided to let me know. So that was one of my finest moments of self-advocacy. I let them know in no uncertain terms that this was not okay, and I was like, I called my physician's office and said, I don't care who calls me back, but somebody with a medical degree is going to give me advice before I get off the phone to tell me what to do. And I said, I know for a fact that you have a physician who comes in at 12 o'clock and she is my personal friend. If she needs to call me, so be it. I don't care, and I know she won't care. And she did. She was the one who ended up calling me. It became a whole thing because at the time I was seeing a doctor who was in like a group of doctors, but I never actually saw my doctor. I got passed around from doctor to doctor, so I didn't even know who to contact or anything. Rest is really big.
Yay.
I'm a huge fan of rest. Wrapping my head around that concept, growing up with a dad who said, like, if you're not doing something, you're lazy, was really hard, and especially as a mom, it's really hard. Saying no more often, which I'm still not great at, but I practice at, has been really good. and really just being my own advocate. Like, nobody else is gonna think about you as much as you're gonna think about you. Staying organized, as much as I hate having to do it. Taking notes, following up when they say the endocrinologist is gonna call you. When should I expect them to call me by, so I can call if I don't?
Yeah.
When they tell me that they will, I still say the same thing over again until they give me an answer. So persistency is great. And that's the end.
Persist. The real message, persist.
Definitely. Thank you.
Thank you so much.
And thanks for not saying no to Andy or Eileen, whoever.
I know,
you
right?
But you can if you want.
I could have,
Yes.
yeah, yeah.
Somehow I wanted to say there's another descriptor for what that is other than persistency too, like, I'm not doing this until you, I don't know.
It's not giving up on yourself.
Right,
Right? Like, oh, I don't have the answer yet. I'm not gonna give up on myself.
yeah. I haven't been heard, and I'm not gonna leave until I'm being heard.
Yeah.
And that's a lot of it. I will say, like, one of the best things about it is, like, I've come to realize, like, how resilient I am. It's insane. Like, I went from being able to run a 5K to not being able to walk for 6 months. And now I can walk again. And then there's gonna be a day that I can't again. And that's okay, because I'll get back up and I'll do it over again. And that's frustrating as hell, but, like, I know that nothing's gonna really hold me down for very long. So,
Nice.
hopefully.
Everybody breathing? So, thanks. So what I'm thinking would be good is to take a moment and ask to talk with someone close by you for a moment. And what we want to do is glean a toolbox. So we're going to spend the next 10 minutes creating a toolbox that we can take a picture of or have in our mind. So turn to someone, and the question is, what are the strategies, what are the phrases, what are the questions, what are the attitudes that you've heard that we want to take away, okay? I'm going to give you like 5 minutes. So turn to somebody, and that's the question. What are the takeaway tools that we want to capture in a minute?
You can be in bigger groups too.
Yeah,
It doesn't have to just be pairs, if that works.
That's good. Grab somebody and we're going to try to
We
glean
can be able
tools. What are the gems that we want to capture in our
I've heard
toolbox?
of people who go to a doctor because
They say it.
something is a problem, and they're like, oh, you need to do this.
You guys ready? So what we want to do, y'all, is pull this together and create a toolbox that you can take with you, and Colleen's going to be described. So let's hear from folks. Yes, George.
Don't shut up.
Don't shut up.
They won't say.
Other folks, and we're going to try to pull together a toolbox. I, of course, have some things extra that if you don't say, we can say from the literature, but let's hear from us. Laura.
I had a hard time imagining doing this, but it was very exciting to hear you saying, I need this, such and such, whatever, I need this answer, I need this information, I need this, somebody telling me what I need to do about this situation before I leave here.
Right.
I'm not going anywhere until he, whoa.
Can you capture that somehow?
I'm not going anywhere.
Right, yeah. And even just to say, I need this,
I'm not going anywhere until I get an answer.
Yeah.
I once refused to leave a hospital without a neurological consult, even though I was there and they were releasing me for a gut thing during COVID, and I didn't have COVID, and I refused to leave, and I finally figured out that the sentence to, they wouldn't send me anybody from neurology, but the sentence I had to use was, I'm certain I'm a fall risk if I go home without this consultation. And it magically produced a neurology PA who said, yeah, you're not wrong about the fall risk, but I think you're okay, and, you know, we'll put in your chart that you had a question between the correlation of this, right, and the other stuff. And you have to, and you can't count on them to communication between doctors. My neurologist who I see her every 6 months, who I hadn't seen for a long time, since before the heart attack, in the same hospital, was not informed. They never sent her a note that I'd had a STEMI and almost died, so it was news to her. So on neurological exam, she notices I've got a difference in sensation in my face, which is above my last spine surgery, therefore I'm going for an MRI on Wednesday to make sure I didn't have a little stroke. The MRI about this possible stroke took 6 weeks to schedule, and it's already, 7 months after the heart attack. So, because they didn't communicate. So, tool-wise, that would be communicate with your other doctors yourself.
So you serve as the coordinator?
Yeah, it didn't used to be necessary, it's completely necessary now. And I think, as older people, which we all are pretty much in the room, we're used to medicine working differently. We expect it to work a little differently than it is. They're all siloed now. No one is speaking to each other. So we have to inform everyone when something happens.
Let's hear a couple more.
Karen.
Karen and then George, yeah.
Follow up on referrals.
Yeah.
Oh, yeah.
And I don't know how to say this briefly, but George made a really good point.
I was gonna say the same thing, I'll call it reverse referral.
Good way to
In
put
other
it.
words, you've been referred, you call the person, I haven't heard anything. Can you call the doctor that was supposed to refer me to you, and can you contact them?
Yes.
Tracking it backwards so that it gets done.
Getting the person who's supposed to give you the MRI or whatever to call your PCP to say, you were supposed to refer.
Right.
We're gonna have to move kind of quickly, so just other folks, what are some of the tools that you've heard our speakers model for success?
Rest. Yeah, put it on there, it's such an important thing.
Talking to friends and acquaintances and letting them know what's going on, and then finding out what some of their workarounds are.
Great. A circle of support. Tara?
One thing that you mentioned about befriending, like the nurses and the staff people, like I found really critical befriending schedulers.
Yes.
Oh, yeah.
Schedulers are the ones who really can make a huge difference in making sure you see the right departments.
We
And
also,
I bring gifts to all of my appointments.
wow. I was gonna piggyback on that and for Donna's piece on humanizing. And it's also being vulnerable. I'm scared. I need, to just communicate from your heart and not just insistence, but some of those letters.
I have
were
one that
powerful
just
for me.
popped into my head. It
Yeah.
worked really well. I had a series of events, crying.
Oh, yeah.
Oh my God, the door's just open.
Maybe for you.
That's interesting.
Yeah.
I have been
Not always.
abandoned by a doctor in a room because I started to cry. 20 minutes later, one of the nurses came in and offered me some water and said, I don't know what happened to him.
Wow.
Like he just couldn't.
He freaked out.
So yeah, be careful with crying.
I mean, I didn't do it on purpose.
No, it really depends on your audience.
So I want to just quote you, Dina, that we have a toolbox and some of them are good, some of them aren't. Obviously, bringing somebody with you is good for some, not for everyone. Donna, you're interviewing. I think what sticks with me there is that if we can find the right doctor. So there were people that you rejected that weren't.
Yeah.
So finding the right person to our medical team is huge. Yeah, a couple
You
more.
can't always find the right person, I mean,
Don't always have a choice.
Right. Any thoughts about what to do if we have to compromise with the person we're working with?
Well, I just note in my mind that they're a placeholder. They're a placeholder and, you know, it's like I'm clear with myself that that's the reality and I'm on the lookout for
Right.
somebody else.
I feel compelled to raise the issue of what to do if you lose your insurance, right?
Cry.
A lot of crying.
So much
and
crying.
so much crying. Call your state representative. If you need help advocating or finding resources, that's one place they do personal advocacy for constituents. So if you're desperate, call them, make noise. And not about, but say, can you help me find care, right? The other thing is knowing who your friends are, who can help you with money for medications. I hesitate to say this, but I think we're in a really critical place where a lot of people are going to lose access. I had a conversation with my cardiologist about the medications, the new heart medications. I take 6 of them that are safe for me to stop taking, and which are most important for me to keep if I lose access to my insurance and can't pay for them. And it's caused me to think about which of my friends can I ask to help me cover my medications. This is dire, and I don't say this with any kind of comfortableness, but if you're dealing with a serious condition right now, and it's not just our audience here, but our audience out in TV land, do some planning now. The pharmacist, when I got my meds refilled the other day, said, I hope you're stockpiling, right? So we're in really choppy seas, and we have to be thinking more carefully about what our care circles are and who we can care for. If you know somebody who's vulnerable and is keeping it close to the bone that they're vulnerable, tell them you'll help. You have $50 you can shoot them every month to help cover their heart meds or whatever meds. We have to be a community of care going forward, and to see ourselves innately, intrinsically, as parts of communities of care. Maybe it's on our street or in our hallway or our church or the other people we run into in the library or our kids' classmates' families, whoever it is. But that's my thing these days.
So, Tara, and then I'm gonna circle us out. Yes.
Related to that is know your people and know yourself and your skills. Because like some of the people in this room I've been doing some movement work with, and each person has a role in movements. So it's very similar to like a care team. Like some people are able to go to a meeting or with the doctor. Some people can't.
Right.
You end up having to help them because you're holding their emotions. So it's a matter of like know your skills when you're helping someone and also know your people.
I want to direct you to your handout for a moment, if you don't mind. And just let you know that there's 2 documents there that I think are going to be handy. One is, and this is from this new colleague, Gabby Cessalini. And she has a list of questions and responses. So you have one document that's for phrases and questions you can ask. And I'm thinking of the example, like, I don't have the perfect doctor. I don't have a responsive person. Like, how do I hold them to account? So these are awesome phrases. I don't understand. How, Dina, you actually said this too, like, what are other people who have this condition dealing with this? When am I gonna see you again? How do I get the questions answered that you weren't able to answer today? So this is just like some advocacy, empowerment questions that you can ask a medical provider to help fill the gap so that you can be insistent, that you can get your needs met. So don't miss that question sheet. The other piece I want to quickly say is on old cards. The other handout you have is entitled, it's a little acronym, but it just brings in that The medical provider, there's research that they have requests too. So here's what they want from us. You know, because obviously we're talking about two human beings. If it's a partnership, then in fact, take a moment and let's think about what their needs are. And this is what they ask for their patients. This is what research says they're asking from us, to be honest and open, to prepare. And obviously sometimes we haven't had a chance to or we don't, but there's some suggestions in this about how we might prepare. So it talks about trying to get as specific as we can. So the last example at the very bottom of the page is, so when the doctor says, well, what's going on today? And you say like, instead of saying I feel terrible, I might just get really detailed. So it gives you actually, there's symptom logs that they suggest that I can come saying, I started to notice my chest pain on Tuesday after I went for a walk, and then the pain now is in the middle of my chest, but I feel like how do we sort of, this is meant to be a preparation strategy so that we can maybe do some work, and those are the kinds of the things that they ask us to do. Also following through, like, you know, we have this agreement. What does that mean? You know, to have communication if we decide we don't want to do this. How do we communicate with them instead of just dumping the plan? So there's that too. So I want you to have that. So I thought we would end with one thing you guys want to do in your life coming up, a question you might want to ask, a person you might want to ask to go with you or not, some kind of action you want to do to prepare for your next appointment. What might you do from here that might be an application for you from some of this information? I know that a lot of this at the end kind of came at you as a flood.
Andy,
Yes.
I had a thought, I'm not sure if it
Sure, go ahead.
quite goes with your question,
Go
but
ahead.
I had this thought that I think it makes sense for me to practice asking for help. Like, before I could actually ask somebody for $50, I might find others, very small ways, to kind of get it out of my mouth to ask for some little things.
Yes.
Could you do me a favor, possibly, and do blah, blah, blah?
Nice.
I'm just not in the habit of doing that a whole lot.
What would be, so what would, I wonder what your prefix was, Laura, I want to say it again. What else would be helpful? What do you want to take away and do from here? What might be helpful next from you?
Are you asking me for something? No.
Everybody.
Okay.
Thanks.
Just saying, I need the answer, and I need it, and please give it to me, and not back down.
Great. Great. Awesome modeling, right? From these guys, how to not back down. Yeah, I'm not getting it up till you give it to me. Well said. Anyone else? Leo?
Offer to go to the doctor with people.
Do you want to do a plug for the
Offer
your
to give them a
program?
drive, even better.
Serious illness program?
You guys, this is cool.
Yeah, so we do have volunteers. We have
What's the name of it again?
the Serious Illness Program as part of the Center for Solace. And so we do have a crew of trained volunteers, some of which are here today, who part of what they can do is accompany people to a doctor's appointment, or, you know, just go along for the ride and wait in the car, or, you know, whatever it might be, talk about it on the phone afterwards. You know, there's a lot of different options.
Thank you, that's
yeah.
awesome. Yep.
I have one, and it is something that I've started doing and hope you will share with me, on severity at the bottom of the list. And on a scale of 1 to 10, 10 being the worst pain you've ever had, I have stopped asking that question. I have started asking, on a scale of 1 to 10, how distressed are you by this pain? Because it might be a pain in a new place, it's not hurting more than a 3, but I'm really distressed about it because it's my heart and not my back, right? How distressed are you? And it lets the person measure for themselves, and they're not trying to figure out if I say a 7, am I complaining, right? Measure the distress. Pain is pain, measure the distress.
Please.
Oh, I was just,
Oh, I see.
Do we have a minute to just appreciate our panelists and the people who put this together? And
Thank you. And you guys for coming, sharing your
Yeah.
wisdom.
What a nice
So there's, I
room.
wanted to say this was kind of an experiment, and the first time, we might do it again. One other thing we could do with longer time is do some practicing and saying some of these questions. So I guess one invitation is to look at some of the questions on here and just see how easily they roll off your tongue. To be able to say to your medical provider next time, you know, I feel terrified, and I just would really appreciate you giving me some more information so I can walk out of here a little less terrified about what you just said. Or, you know, just to practice some of these skills, because some of them don't roll off the tongue so quickly. Thank you. Thanks, Eileen. Thanks, Center for Solace, for the great work you do.
Anyway,
It was lovely to meet everybody, thank you.